Good morning, everyone. Welcome to this month's third Wednesday Parents Resource Chat, Healthy Kids Mississippi. I'm glad to be your host for the day. My name is Michael Miner, and I am the Executive Director of Oak Hill Regional Community Development Corporation and Healthy Kids Mississippi. Look, we're excited about today's session. We hope that those of you all that are watching us on social media, whether it's Facebook or YouTube, that you would take an opportunity to share with someone else. A lot of good information is going to be shared on today. Tag somebody, tweet somebody, share some good information on today. All right, before we begin, we do want to give a shout out to our very capable and awesome board chair, Jennifer Garrett, and to our project director, Lottie Miner. And of course, all of the board staff of Oak Hill Regional Community Development Corporation and Healthy Kids Mississippi, all across the state of Mississippi, we greet you today. All right, look, this is what we're going to have today. We got three things. And the second thing is going to be most of what we're talking about today. First, we're going to give you a quick update from the state on COVID-19. And then we're going to go into the biggest part of our discussion today. I have a very special guest to share with us about the COVID-19 vaccinations and children. And then we'll close out with a few updates about health insurance. Of course, as always, we're going to do our best to capture your questions. We know that every time we do this, there are more people watch us on our social media, but we're going to do our best to capture your question across all of our platforms so that we can be able to accommodate you on today. All right. And look, always, every time we have one of these sessions, the feedback has always been, it was informative, it was great. So guess what? We're going to do our best to live up to our reputation. All right. Okay. Well, let's begin with our first part, which is an update on the COVID-19 pandemic. Now, look, I know a lot of people have, like myself and my wife, we've already gotten both our shots. We're past the 2 weeks and everything, and everybody's getting happy feet. All right. But we want to remind you all, we are still in the middle of a COVID-19 pandemic. Yes, I know the news headlines no longer talk about it. Some news shows don't even mention it, but we are still in the midst of a pandemic. So the latest numbers for Mississippi, today, 233 new cases. All right, that gives Mississippi almost 310,000 cases total since the pandemic started. And contrary to popular belief, people are still dying. There are 2 new deaths that were reported today, giving us almost 7,200 people who died in the state of Mississippi since the pandemic started. Now, look, this next thing really bothers me, you all. Really bothers me. With all these vaccination locations, with our hospitals, with the community health centers, with other, the states, all these different things, only 22% of our total state population has been fully vaccinated. Come on, folks. Let's get going. Let's get going and get our shots and get it done. And once you get your shot, make sure you still wear your mask. Yes, still wear your mask. Still wear your mask. Still practice physical distancing. Yes, still wear your mask. And do the right thing on it. All right. Now that's our update on COVID-19. Now for the big exciting part of what we're going to do today is we're going to share about children and COVID-19. We are fortunate. I'm going to bring him up to add to the screen today. We are so fortunate to have Dr. Nathaniel Boutte, a pharmacist with Walgreens, and I asked him what he wanted me to say a whole lot about him. I was impressed because he's for over a decade more. He's been working with in the HIV/AIDS arena in underserved communities. That really was impressive to me. And he said he wants other things. The dad got a couple of kids, and he's really concerned about his community and is taking his job much more than the paycheck he receives there at Walgreens. So we are happy glad to have Dr. Boutte on with us. Dr. Boutte, good morning. Good morning.
Good morning, Mr. Minor.
All right. Good. Well, we got some questions to go through this thing. And look, I want to warn everybody, I'm riding solo today. So if you see my head turning and I'm doing different things, I'm checking all of our Facebook posts and everything. And I know, don't y'all tell me you got software that can put all this stuff together. Well, look, we're not in that kind of realm yet. We're gonna make it do what it do. All right. We'll tell you. All right, he's got a smile on his face. That means he's ready for some questions. All right, here we go. Look, this is the big question off the bat. Okay. And I don't understand why they have this question, but they ask, will talking about, I just said getting shot, will talking about COVID-19 increase my child's anxiety, their fears?
So, good morning, everybody. Nate Boutte, pharmacist at Specialty Walgreens here in Memphis. And the short answer to that question is yes. So all the information I'm giving y'all today, I'm letting y'all know, is coming straight from the CDC, right? So our CDC website is where I got my research, where I got my information from. And I know the question was phrased to me as, when is an appropriate age to talk to your kids about COVID-19? And my answer to that is, as soon as they can understand it, because you have to think about this. Say you have a 5-year-old, right? They understand most basic stuff. They get in the car, time to eat, those types of things. Why do I have to wear a mask? Like, that's going to be different for them, right? So wearing a mask, we're going to have to do some type of explanation for these children. And one of the things that they recommend on the CDC website is just like, number one, remain calm. Remain calm. Like, children are going to react to you. And that's going to be a recurring theme today. And the answer to these questions is your kids emulate what you do. They do what they see, and you're the one that they're watching. So you stay calm, they're going to stay calm. When you reassure them and let them know that, hey, that stuff is going on, but mommy and daddy are here. We're going to protect you. We're going to make sure that you're safe. We're going to keep things as safe as they can be. So, that's the most important thing, is making yourself that you're available to your kids. Bring it up and talking about it, because it's just, like the old saying, do you want your kids to hear about it from somebody else, or you want them to hear about it from you?
True.
Right? True. So you want them to definitely hear about it from you. So yes, talking about it or not talking about it could make things worse in the sense of them hearing it from somebody else. But the best way to do it is sit down with them, have that conversation, answer the questions that they have, and reassure them.
All right. Well, let's follow up on that. We've been hearing all the stories about the kids in the COVID-19. Why isn't COVID-19 as risky for kids?
So for whatever reason, COVID-19, although kids can definitely contract COVID-19, so don't get that twisted. They definitely can get COVID-19.
Right.
They don't have the same level of reaction to it. And so a lot of times people compare COVID-19 with the flu, because that's just a virus that everybody's familiar with. And every year, lots and lots and lots of people get the flu, right? But only select groups of people typically die from the flu. Now, don't get it wrong. The flu kills lots of people every year, but those tend to be very, very young and the very, very old. So COVID-19 is similar in the fact that select groups, much, much older groups, as well as those with underlying health conditions, are the ones that are most heavily affected by the COVID-19 virus. That being said, children can get it, and they can suffer some side effects and adverse events from contracting the virus. It's just that they tend to get over it without there being a lot of problems. Okay.
All right. Well, should we go and talk to our kids and let them know what the symptoms are? Sometimes people get psychosomatic, and if you say I get a runny nose or something, oh, mom, I got COVID, so how should we handle that by talking about the symptoms?
So when we're talking about the symptoms, if you let them know that the symptoms are very similar to a cold or a flu, or just symptoms that they've had before, that doesn't mean that it's COVID-19. I think that they will understand it. Obviously, every child is different, every household is different. But just so y'all would know, I do have 2 kids. I've got a 3-year-old son and a 9-year-old daughter. So I've kind of got both ends of the spectrum there.
I see.
One who has no idea why he's wearing this mask while we're walking around in Sam's, and another one who's got all the questions in the world about, well, COVID-19 this, and I heard that, and my friend at school said, her mama said. So we go through all of that and letting her know that, like, COVID-19, yes, it's out there. It is a possibility that you could get it. Someone in her class actually did come down with it. So that was a
Oh,
very, her class, they're quasi-virtual, quasi-in class at her school here in Memphis. And, one of the kids came down with it and they had to quarantine the entire class. So we actually went through this whole process,
wow.
but just explaining to her, like, hey, have you ever had a runny nose before? Like, yeah. Was it COVID-19? No. Like, okay, so you can have a runny nose without having COVID-19. You can have a fever without having COVID-19. If you
Okay.
do have a certain group of symptoms, which she's had before, like during this past year, she's had a runny nose and a fever. So she could not go to school without having gotten COVID-19. She's been tested for COVID-19 twice now in the last year.
Okay. Okay.
Twice. Both times it was negative. But again, it's just out of an overabundance of safety. We just want to make sure that you don't have COVID-19.
Well, look, I like this. A nice segue. So I'm sure your daughter was like concerned when that came up and everything. So how do we work with our children to overcome this anxiety and worry about COVID-19?
So overcoming the anxiety and worry, I think, really depends, number one, upon the child, how much they have to start out with. So, if you have a child and they're not too concerned about it already, probably no need to kind of really beat them over the head with, like, hey, it's safe, we're here to save you and protect you and so on and so forth. But if you do have one that, they're starting to withdraw, for example, things that they typically do, they're not doing, those can be some of the red flags for you as a parent. So you're like, hey, what's going on with my son and my daughter? Talk to them, like, hey, talk to me, talk to dad, talk to mom, let me know what's going on with you. Are you worried? Like, you used to love to go to the park. Like, why do you want to go to the park anymore? Well, I'm worried I might get the COVID and so on
Okay.
and so forth. And explaining to them the things that we do to protect ourselves, wearing a mask, doing the social distancing.
Okay. All right. Well, let's go on. So suppose that their school, the daycare gets shut down and everything.
Yes.
And they have to self isolate. So how are you going to handle that situation?
So the self-isolation thing, that we definitely went through that at the end of last school year. So her school was actually on fall break when it first hit. And so they just kind of like, okay, well, that was it. School is closed and we home the rest of the way. And what has happened over the past year is most sort of kid things. So what I would say to people is, like, think the normal kid thing. So for example, going to the museum, right?
Okay.
You take your kids to the museum on a Saturday, got to self-isolate. A lot of these things are available now in some form virtually, right? So you can do a virtual tour of a museum. I know just past weekend, for example, the dinosaurs came to town, right?
Oh, yeah.
The dinosaurs are inside and you're walking around and you're doing it. Yeah.
It's a Liberty Bowl. Yeah.
Exactly. So now the dinosaurs are a drive-through, right? So you get in the car, you drive, you go to the little stations, you get to see the dinosaurs, you take your little pictures and everything like that. So a lot of the same things that have always been available are now available, kind of like with the twist. So just whatever you would think, what would you normally do in this situation? Go ahead, Google it, see what they're doing now for that type of thing.
Okay. Wow. Isn't that something? So you kind of went to my next question, and we talked about the activities and things that people do. I just want to add one other thing in there and everything. It's amazing how creative you can be when you have to be creative. Okay.
Oh, for sure.
Well, look,
be surprised.
Right. Well, what about grandma? One of the things early on was saying, look, the kids are terrible because when it's COVID-19, because they can get COVID, don't really bother them, they come home and give it to grandma and kill grandma. So can grandparents visit even if the parents are just halfway vaccinated?
So, and this has been a tough one. So this has been kind of my personal little story about vaccines, just in general, like vaccine hesitancy. So my mother-in-law and father-in-law are both well over the age of 70.
Okay.
And your grandson, he's a whole 3. And they love him coming for a week and stay as long as he wants and get spoiled and, get to just wreak havoc. So once the vaccine became available, my wife came in one evening, she was just like disappointed. I was like, babe, what's wrong? She's like, I just talked to mom. I don't think she's gonna get the vaccine. I was like, oh no. I was like, why? Why? I said, I mean, she was a nurse for many, many years, and she's fine, and like she's doing the social distance. She just don't think she needs to get the vaccine. I was like, well, I guess she's not gonna need to see her grandson either.
Oh, wow.
It was like, what? So my wife was, she was on board with it because she's been with me the whole time, and I've been just kind of COVID kid over here telling anybody and everybody about the importance of getting vaccinated. Okay. And we very politely let them know that, hey, we're not going to risk you all's health by having our son come there where potentially he could spread COVID to you and you could pass away from it. We don't want that on our conscience. We just can't have that going on. And with that extra motivation,
I was gonna say,
and thank the Lord, both of them have now been fully vaccinated, and we're planning that week trip over there for my 3-year-old to go and visit grandma and grandpa once they're ready to have him come on by.
All right, everybody. All right, here we go. So I want y'all to catch this. What Dr. Boutte said, one way to get your grandparents and stuff, your parents to get going, is to use their grandkids as an incentive. Okay, all right, I like that. All right. Well, now, what about the summer, the rest of the spring? Although last night felt like winter, but for the spring, I know, go figure. All right. So look, it's been over a year. Everybody's stir crazy. I mean, how normal can we be for the rest of the spring and through the summer with our children?
So, like you said at the top of the show, we are still in a pandemic, y'all. Like it is tough. It is really, really tough. I completely understand. Like, I know it was probably a week or two ago. I was outside, it was spring. I had my shorts and my t-shirt on, and I hopped out the car, ran into the Walgreens to grab me a soda, and I got in and I realized I forgot to put my mask on.
There you go.
Running around without a mask on. And I literally ran in and ran out. And then when I was paying for it, I used my phone to pay for the stuff or whatever. The Face ID thing worked. And I was like, oh. And she was like, yeah, I know you don't have a mask. Oh, I'm so sorry. And it's easy to forget. Like, we've been doing this for so long now, but we're getting there. Like, the fastest way to get us back to what we consider normal is get as many people vaccinated as possible and talk to as many people as possible about getting vaccinated. Once you've gotten your vaccine, the words that you say to somebody who has not gotten their vaccine, when they hear that you've gotten it, so powerful, so powerful.
Yeah, I changed my little Facebook thing there. I got the little thing that I've been vaccinated. We can do this together. I've been doing that.
Yes. Do that. Every little bit helps. I mean, literally, part of my job, but part of the things I've been doing through my job, through the connection with my job, is I've been working with a lot of churches as well. And we'll tell them about things like, I'm going to tell people about this. And when they see that, well, this guy, he seems like, what he's talking about, and he got vaccinated. He made his grandparents, get vaccinated. Like, maybe it's not that bad. There's a long history about hesitancy with medications, especially in our Black and brown communities. We got a lot of that here in Mississippi and in South Tennessee. So understanding that hesitancy is there. And we get that and we understand that, but we also want to get back to normal. And, part of that getting back to normal is getting that vaccine. We can't give the vaccine, and I know this is probably a question further down, so, spoiler alert, we don't have the vaccine available for people under the age of 16 yet, so we can't do anything there. But for 16 and up, we can get out there and get that vaccine.
And we've been pushing team. We had a drive-through session at our church last week, and I was pleased to see the number of parents were bringing their teens, 16 and up, to come and get their shots. That was really, really warming for me. All right, now, if one dose of those vaccines confers significant protection against disease and probably also against asymptomatic shedding, why do we need a second dose? Couldn't we? Now, we're not talking about the Johnson & Johnson, but we are obviously referring to, and let me put a disclaimer out. I'm just going to be honest with you. I learned a whole lot when we get ready to get this shot done. The people were interested in the Pfizer shot. I don't know, for whatever reason. They definitely were not interested in Johnson & Johnson when they come up, but people were asking about what we're going to offer. So why do we need to have this second shot and the two-dose regimen?
All right, so we're gonna try to get fancy for a second. I'm gonna share my screen with you. All right, so bear
All right,
with
here we
me.
go. All right.
Let's see. Let's see. I'm usually use Microsoft Teams and not Zoom, so let's see what we can do here.
All right. Oh, he did it. There you go.
Got my hand washing screen up there.
All right, there you go.
Okay, now let's click over here. Got a quick video for y'all to watch.
All right, look at the video in the video.
Even though your body begins to build immunity after one dose of the Pfizer or Moderna vaccines, the studies show the optimal protection from these vaccines is 2 doses, while the Johnson & Johnson vaccine is effective at 1 dose.
Okay. Well, that guy looks familiar in that video.
Yeah, you seen that guy before, huh? So that's one of the things I've been doing with Walgreens. They selected me to be one of sort of the faces to be on the YouTube channel and the website talking about the vaccine. And that's actually one of the questions that comes up a lot. And I guess, I don't know the simplest way or good, I don't have a good analogy for this one. Normally I'm comparing stuff to basketball or you know, cooking or something like that. But this one is really not a strong analogy for it, other than explaining that all the information that we have on vaccines and just medications in general are based upon studies that were done prior to the vaccine or the medication being released sort of to the public.
Okay.
So what they're able to do is when you get the vaccine, they're able to test for antibodies, right? So antibodies are what provides that protection from the actual virus in your system. And just like, for example, the reason why, and this is not really a question, but this is just something you guys should know, that if you've had COVID-19, you know, the question is, well, I already had COVID-19, should I still get the vaccine? The answer to that question is yes.
Okay.
Because your body's response to it may not be as strong. You may not produce as many antibodies as you would if you get the vaccine. So still want to get the vaccine. You definitely want to get the second dose. I could go into a whole can of worms about, you know, those out here who got 1 dose of a 2-dose vaccine and the increase the chances of variants and things like that happening. So, you know, we talked about HIV a little bit, and, you know, that's one of the things that we worry about with HIV patients is they're not taking the medication the way they're supposed to. We can create different strains of HIV that are kind of too strong for what we have. So definitely, if you're getting a 2-dose vaccine, get both doses.
Well, it kind of like when they had the sinus infection, something, and the doctors perhaps the antibiotics, and wow, it's like, please.
Absolutely.
14 days, just because you feel bad after 3 days.
Yes, because it's like, you know, if you only take it for a few days, you don't completely kill that bacteria, it's going to come back. And when they say it's going to come back stronger, it will literally come back stronger because it's going to be, what happens is virus and bacteria, they replicate very, very, very quickly. So you will have virus or bacteria that's replicating in your body while the medicine's floating around, but it's not enough medicine to kill it. So the new little bacteria babies that come out, they've seen that before and they not scared no more.
Wow.
You giving it, you know, this amoxicillin. It's like, no, I was born in amoxicillin. So amoxicillin does not kill me. So same thing, like if you don't have enough antibodies, you don't have enough protection, there's potential for some different things to come out that are, you know, not that great. Like I said, it's a whole can of worms. We're not getting into that deep on it.
Well, the only thing I add to it is that we had a situation. Well, I'll just be honest. We had at our church, we have that we have to have everybody wear a mask, even vendors. And we had one vendor who said that he wasn't going to wear a mask. Obviously, we didn't end up doing business with him. But his thing was that he'd already had COVID-19. And I wish that, and I knew he wasn't in the mood to hear what you're sharing. But there are a lot of people who've had COVID-19 that really feel like this, since I've had it.
Yeah, and that's,
I'm good.
It's unfortunate because it does not, you know, having had COVID-19 does not provide the same level of protection that the vaccine does. Now, don't get me wrong. If you had COVID-19, your body did its natural immune response and it created some antibodies. And eventually your body got over COVID-19, prayerfully you didn't end up in the hospital and so on and so forth. But it's not the same. They've done studies. They've shown that, if you've already had COVID-19, sure, you have some antibodies, but getting the vaccine will get you to where you really need to be for that 99.9% protection. That's where you need to be.
Okay. All right. So now, why is it that who's more likely to get infected? Is it kids? Is it adults? Or is it not really any difference at all?
Honestly, it's not really any difference at all. So, they'll say, you hear Fauci, say that the virus doesn't care, if you black, white, yellow, Democrat, Republican, the virus don't care if you 72, 7 months, it doesn't matter. Like the virus just needs to host, and it will go to wherever it can get traction.
Okay. So what about in the schools? It seemed like we had this dichotomy across the country. In certain states that they had the kids going, some they were going virtual, some they were hybrid and everything else. So are our kids safe going to school?
So that was one of those questions where, as a pharmacist, people come in and ask me like, hey, what should I take for my headache? I'm probably ask you a few questions before I give you a recommendation. So the questions that you want to ask, and if you go to the CDC website, there's actually a nice little checklist.
Okay.
And I can probably send you that checklist so you can share with the people that are watching.
Okay.
But what is the school doing, right?
Okay.
Right. Is the school just coming back saying, okay, yep, we're just going to do business as usual, and make sure to wash your hands? Like, okay, it's not the best. It's like, okay, well, we're going to separate our desk by 6 feet, or we're going to separate our desk by 3 feet. I want to say the most recent recommendations are that in a school setting that the desks are separated by 3 feet.
Yeah, I heard that. Yeah.
They no longer need the barriers, right? Saying that, 3 feet apart with the mask. Key point being with the mask. So if you got your school and it's like, well, we can do 3 feet apart.
Worn properly.
Absolutely. It's like, I've done a video on how to wear the mask. Has to cover your nose, has to cover your chin. Okay. All of this nose out or up here is like, no, you might as well. You're just hurting your ears at this stage because you're not protecting nobody. Like you're not helping by wearing this mask behind your chin. But yeah, so what type of things that they're going to do? And then, to be perfectly honest, and it's tough to say this, is the school going to enforce these things?
True.
Because, you send your kid to school thinking, okay, well, they're going to wear a mask and do this and do that. But then if you come back and you pick up your kid from school and it's like, so, how many people wear masks? Well, some people were wearing masks. Some people had them hanging off their ears. Some people had, it's like, okay, well, you guys, if I'm not going to enforce these rules, then, kind of what's the point? Everybody's situation is different. So case in point, my 9-year-old, we have the opportunity at any point in time to say that we want her to stay home, right? Because what they've done there is they're doing in-person and virtual at the same time. So basically they're broadcasting while they're teaching during the day. It allowed them to, like, say when one girl in her class got COVID, they were able to basically have that child learn from home while she was isolated without having to miss any classes, anything like that.
Mm-hmm.
So, our family situation was like, what? It's actually going to be better for her to be at school. Like, we just trying to have somebody at home and so on and so forth. It just doesn't really work for us. So we were glad that was an option. We were concerned, but, having saw what the school was doing and, checking in with my daughter, like, hey, are they really making y'all wear a mask? Are y'all doing this stuff?
Really? Yeah.
And, feeling a lot more comfortable and confident about it, and understanding that even with all of the protections in place, doing all of the right things and washing hands, we can all still come down with COVID. And it's kind of nobody's fault because, it's a virus and it's going to find its way where it's going to find its way. But we can definitely do things to protect ourselves.
Yes. So then let me lump some things together about protection. All right. So first of all, this summer, what can we do? And what's got to be tied into this? Hey, the biggest thing we can hope for, they get vaccinated. So what can we do to protect them this summer? And then how soon can we get the children vaccinated? Because obviously we feel like if we get them vaccinated, that'd be the better protection. I'm thinking, help me with that.
Absolutely. So I am 100% on board. And right now, there's not a whole lot of information. The last that I heard, and I was kind of trying to find some more, like another article about it last night, just haven't been able to see one. But Pfizer is working on extending their vaccine down to, I want to say it was 13-year-olds, which I
Okay.
mean, I have a 9-year-old, so,
That's it.
not there yet, but still, that 13 to 16 range is, that's kind of like your high school, middle school, kind of in that range, getting those. And again, these are some of the people that are going to be more active. And I know we talked a little bit about, sports, right? So
Right.
like sports season's coming up, we're going to
Football in the South.
go play us some spring ball and so on and so forth. And if you go to the CDC website, there's literally there's a little chart on there with like the risk level.
Okay.
Everybody's sort of level of concern and risk is going to vary, right?
Okay.
So, one person may feel comfortable with their child, playing sports against people in their school. Somebody else may feel comfortable playing sports against somebody in another school. Some people may feel comfortable only if they're wearing masks and doing it. So understanding kind of what your level is and explaining that to the teachers, the coaches, the administrators, like, look, if you have only 50% of your football team, parents are saying that, we're going to let our child play against other schools if they're not wearing masks, then you may only have half your team. So it's really, really important to communicate. And I know communication is a little different now, but oddly enough, I find that the virtual thing can actually be a little bit easier because you can kind of do the virtual from your phone, from your computer, from your wherever. Whereas if you get off of work at 5:30 and the meeting's at 6, you're not trying to drive halfway across town to get to the school to be to the meeting because you know what, I'm just going to park right here in this parking lot and get on my phone to get in the meeting. So, don't rule that out. Talk with the parents, talk with those administrators, see what everybody is comfortable with because we want the kids to have a good time. We want them to do the sports. We want them to do all those things. But, right now we might be doing drills. Like my daughter, they're doing basketball. Like all they do is drills. They have basketball, but it's just they practice dribbling, they practice shooting, but they're not playing games. But that's kind of what they were at for this year. So, that was where we were.
Wow, having played in sports sounds exciting. But anyway,
yeah, I know. I was like, drills. Okay.
Oh,
that's better than nothing at all. So we will take drills for now.
Well, look, what about hanging out? What about kids hanging out with each other? Look, I know especially these teens, used to be coming up, your child gets a little friend and whatnot and everything, and you may not mind them coming over, or something like that. But now, can they
yeah. And so, one of the things that have been recommended is kind of forming like your own little quasi bubble, right? Okay. So, finding like-minded parents. So, like you have some parents who like, oh no, we're taking our kids and we're going to the beach and we're going to, a luau or a party or whatever. And, you might not be at that level of comfort, in the middle of the pandemic, So you may want to find somebody that's more like, no, I send my child to the daycare with those 5 people that's at the daycare. And, like, okay, well, both of the parents are vaccinated in this house. Both of the parents are vaccinated in that house. And, so we let our kids, do a play date with this select group of people. Gotcha. I mean, a lot of it is really going to be dependent upon what you're comfortable with. And just not comfortable, just don't do it. There's no reason for you to feel uncomfortable if like you're the only person in the gas station wearing a mask. Look at me funny if you want to, but I'm protecting myself from y'all and I'm protecting y'all from me. Okay. So this pandemic is a lot further down the line. I'm going to continue to wear my mask.
Okay. All right. And look, for those that just joined us late, we are having our third Wednesday Parent Resources Chat. We're so grateful today to have Dr. Nate Boutte on from Walgreens, the pharmacist there. Again, you can share any questions or comments in the chat, social media. We have quite a number of you, thank you, that are watching us on social media. We do our best to field your question. If we don't get to it, we'll come back around to it again and we will be able to follow up. Feel free again to share this on your social media platforms. And this is brought to you today again by Healthy Kids Mississippi, an initiative of Oak Hill Regional Community Development Corporation. All right, so now what is this multi-system? Now first of all, I want everybody to know, if you join us late, we've already said the obvious. kids, parents, everybody needs to wear a mask, whether you've had the vaccine or not. Boom, boom. All right, got that out the way. All right, now for this multi-system inflammatory systems disease in children, we've heard about that. Help me with that.
Yeah. I'm gonna tell you now, I wish I could offer you more help, and I wish I knew more about it. Like I said, I got a 9-year-old and a 3-year-old at the house. So, this is something that gives me concern and pause when we talk about, like me and my wife, we've both been vaccinated, and we talk about like my grandmother, my daughter's great grandmother is gonna be turning 90 this June.
Oh, okay. Bless her heart.
Right, in Houston, Texas. For us to go to Houston, Texas and visit great grandma. That being said, this MIS-C, so multi-system inflammatory syndrome in children, it's basically a condition where different parts of the bodies can be inflamed. So heart, lungs, kidney, brain, skin, eyes, even your GI organs. We don't know right now what causes it.
Wow.
We do know that many of the children that have it had the virus that causes COVID-19. So you don't have to have had COVID-19 to get MIS-C. So you can get MIS-C without having COVID, but that being said, it seems like that's when we really noticed it a lot more, because it was like these kids that got COVID ended up with this other sort of disease state later down the line. So it's one of those things where it can be serious, it can be deadly, but most of the children that have been diagnosed with the condition have gotten better with medical care. Because it is an inflammatory condition, we have a way to treat inflammation. I mean, you can treat inflammation with steroids, non-steroidal, anti-inflammatories. There's different ways to treat inflammation. But it's one of those things that we're we don't have enough information about it. The cases are rare. So there's not a lot of cases out there, and that makes it even more difficult, because when the cases are rare, it's hard to draw parallels. Like I know we haven't talked a lot about the J&J vaccine because it's still on pause right now. But segues, with that sort of thing, when you only have 6 cases or 7 cases out of 6.8 million doses, it's hard to draw a very straight line and say that this is causative. And that's why they're pausing. They're talking about it now to see, is it causative and do we need to make some changes? So same thing with the MIS-C. It's like, well, we know that we've seen kids with COVID-19 get over COVID-19, but then later get this. So, they're going to treat it and go from there. But right now, there's just not a lot of information because there's not a lot of, patients to really look and study and see what else could possibly be going on with it.
It reminds me, I had the chicken pox. Our little family practitioner told after the chicken pox, so I told my parents to say, hey, just make sure to check out after it's all over. Don't have any little things pop up fever. When I do, let me know. So I think it's the same thing, that whatever we have, just be on the lookout. I don't hear about the COVID-19 long haulers. I think the idea that we figure once people get over it, it's done. But I think the idea is village and check them out. The kids walking around acting crazy and stuff. Hey, check it out. But anyway, I digress. All right. So should the infants just out the blue or very young children be tested for COVID? I would say the SARS-CoV-2, or should we just not worry about testing them at all?
So the thing is that infants can get it. Again, like I said before, the virus does not care. So what you're going to do is you're going to just treat them like you normally would treat them. So if you got a fever, if they got any sort of, in which, with a kid that age, if they got a headache, we won't know.
They'll go,
if they have, we won't know. But if they have diarrhea or vomiting and a fever, those things we can know. And I can tell you now, and this has been, for me, as a pharmacist, I'm a manager. I've got about 15 employees that I work with that I'm sort of in charge of.
Oh, big time, Dr. Nate. Go ahead.
And so one of the things that happens is that, we've got all these protocols at
Okay.
work. Like you can't come to work if you have a fever over 100.4. If you have any combination of these symptoms, you can't come to work. That's just the rules.
Okay.
Because obviously, if somebody does have COVID-19, we won't want them to come to work and spread it. So same thing with the infant. Like, if you have a 6-month-old at the house and they got a fever and diarrhea, we don't really want Granny watching them, especially if Granny hadn't gotten her vaccine yet. So what you're going to do is you contact your doctor, and your doctor will be the one to best decide whether or not your child needs to be tested for COVID-19 or your infant needs to be tested for COVID-19. And I got to tell you, in my experience right now, most physicians are just going ahead and doing that COVID-19 test. And it's
Okay.
just one of those better safe than sorry type of situations where it's like, you know what? I thought it was strep, but as it turns out, it was COVID-19. So I got this COVID-19 patient running around when they should have been isolating.
Okay.
Just shutting all that down. We're like, nope, we're going to assume it's COVID-19. We're going to get you tested. When we get the results back, we'll see. If it's not, then we'll test some other things. So generally speaking, if your infant is showing those symptoms, get them into the pediatrician, let them know what the symptoms are, and go from there.
All right. Well, you just got to talk to each other about grandma there. So, is it wise to have them spend not only with grandparents? What about grandparents got diabetes and high blood pressure, enlarged heart, and everything? I think we kind of repeating ourselves, but I think it just
No. So, So say you have grandparents or even not grandparents, auntie, uncle. They have any of those underlying health conditions, and here in the South, we got high blood pressure, diabetes, high cholesterol.
sugar diabetes now. Sugar diabetes.
That's right, the sugar diabetes.
Yeah.
Those are some of our favorite disease states to have here in the South. When we eat good, we put a lot of butter on things, we put a lot of sugar on things. Like I probably have never had vegetables that didn't have butter and sugar in it. Like that's how I make corn. My wife, she's from Nashville, and she's like, "You always put butter and sugar on your vegetables?" It's like, well, yeah, that's the way my mama cooked them. So that's
Right.
right.
Yeah.
So we can have a whole nother meeting about healthy cooking, but
Right.
we do have a lot of people who are in their 30s, 40s, 50s who are not grandma and grandpa just yet that have these underlying health conditions. And again, best thing they can do is get the vaccine as soon as possible. That's just the number one best thing they can do. But taking those extra safety precautions, because the children can carry it and be asymptomatic. And that's the thing which for me has made this the most frightening thing about COVID-19 is our asymptomatic carriers. Somebody, no fever, no headache, no nothing. They feel the same today as they did yesterday, but they are walking around with COVID-19. So that is the reason why you still wear your mask, wash your hands, do all of those things. It's what we call in the medical industry universal precautions. If you come into the hospital or the pharmacy or the whatever, we are supposed to treat you like you have all of the diseases.
Oh, okay.
Whether that's cancer, HIV, tetanus, whatever it may be,
Right.
we have to protect you from us and us from you. So a lot of times people feel offended if they put on gloves, like they don't want to touch me. Like, no, that's not the real protection. Like the protection is, where have my hands been?
Exactly.
I'm in a hospital. What kind of germs are in this hospital
Exactly.
that you have at your house? I'm putting these gloves on to protect you just as much as they are to protect me. So same type of thing with COVID. We just have to assume that anybody and everybody could be walking around asymptomatic with COVID.
All right. Now, what about the fact we get things lined up, and I'm taking care of my niece, and they only got one car seat, so I get the car seat out of your car, put it in mine. Should I be real worried about kind of really disinfecting their car seat and everything, and make sure it's not any COVID running around, stuff like? What about that?
So the studies have shown, and trust me, we went through this early on, where my wife, when I would come back from the grocery store, I was going to the grocery store like twice a month, getting a whole lot of stuff. But I mean, she would like Lysol down the bags and the containers and everything, because we just didn't know.
Spray you too.
There you go. So the more studies that have come out to show that it does not live long on surfaces.
Okay.
Virus. So you're probably okay without having to like completely disinfect the entire car, but it wouldn't hurt, hit it with a little Lysol, that alcohol swab, not a wet wipe. Okay, so let's get this straight. You got kids, wet wipes everywhere. I keep wet wipes in all parts of the house in the car. They're good for wiping noses and bottoms, but they have no alcohol or no sanitizer effect at all. Okay,
True. That's true. That's true.
Those hand sanitizing wipes that have that alcohol in them that will kill those germs. The other thing is, guys, especially when you're dealing with kids, hand sanitation, sanitizing stuff, that's just good practice already anyway.
Yeah, in general.
I mean, it's like one of those things where after I go to the gas, I keep a little hand sanitizer in my car. After I go to the gas station, pump my gas, I always put the little hand sanitizer on. And when me and my wife first met, she said, I thought you were a germaphobe. I was like, I'm not. I have a young daughter, and like I never know when I'm gonna be feeding her some food or doing some whatever. And just, I don't want to be the reason why she got sick. So like I know that's the easiest way to spread is, your hands. Get your hands dirty, spread the germs. I just try to keep my hands as clean as possible. Like as I sit here in my office, can you see that there? Got my hand sanitizer.
Two times.
I got my hand sanitizer right there. And I mean, it's all day, every day, washing my hands, hand sanitizer. I mean, I know that was one of the questions that we had kind of mentioned before, like kids and hand washing, right?
Yeah.
Like, how do we get the kids to wash their hands? And it's one of those things. So like I said, I have a 3-year-old. So we're working on potty training right now. So you can imagine how fun my life is with that. But one of the things that we do is like every time Daddy goes potty, I get up like, hey, let's go potty. So, he come right in there with me, close the door, handle our business, flush toilet, and then wash hands, right? So, he's gotten used to that routine of go to the potty, flush toilet, wash hands. Okay. He sees me wash my hands all the time. And that's what your kids do. They always see you. They're always emulating you. You are their hero, right? Anything you do, they're going to want to do. So like, if you're using some language that maybe grandma shouldn't hear in front of the kids, don't be surprised when the kids use the same language. All right, that's the same sort of thing. So we want to use this time in their life. Their brains are big old sponges right now. Their eyes are just watching and seeing everything and just mimicking it. Let's have them mimic those good habits. See me washing my hands, see me eating this apple, see me doing these healthy habits and things like that.
Okay. All right. Well, this other thing here is we're seeing kids starting going to prom. I've written a story about they had this big building and two dance floors, spread everybody around, and graduation and things. Wow. Shouldn't let my kid participate in stuff like that, because look, when they're kids, and even though you kind of associate this a prom, a graduation, I gotta give a high five. I gotta give. But what do you think?
Yeah. So. That's a tough one because I the last year, class 2020, I was, I had several friends and family members that were part of that class, and I had I had felt bad for them. It was like, you didn't get to walk across the stage. We're doing the virtual and things like that. Now that has now extended. Like class 2021, y'all about to graduate, and we're doing. Some people are doing like an in-person for just the students. Some people are doing it where you can have like one guest or whatever. Again, with those type of things, it's going to really depend on your level of comfort, as well as what the school is going to do. Like what's going to be in place. Is it really going to be like, okay, we got 3 floors and we're going to limit it to, no more than 20 people per floor or whatever the case may be. So there's plenty of room for social distancing and so on and so forth. And then like, how's the process been so far? Like, have y'all been at school in person and, it's been working well, or have y'all been virtual the whole time and now y'all about to bring,
gotcha,
40, 50 different households all together in the same building? And I would say I would probably feel more comfortable had my child already been going to school in person, knowing that the school
makes sense
in place.
Okay. All right, let's lump this last few things together. We have some questions more about the vaccine and children. We touched on it a little bit. Is there anything else that you'd like to share? We've covered quite a bit about the children and the vaccination. So I think we got 2 parts to this question. We have the existing thing for people 16 and up.
Right.
Yeah, and then about the other. So what else can you go shed on it? And I think this will get us right into our Q&A part.
Right. So basically, right now, they are testing the Pfizer vaccine in, I want to say 13 and up, right? So 13 to 16. And
Okay.
they are saying that they're pretty close to applying for that EUA, which is emergency use authorization, which is what we are doing now with all of the current vaccines.
Okay.
Uh, and I want to say that last I heard that they want to try to maybe apply for that as early as next month. So we
Okay.
could be looking at near the end of summer having a vaccine for children down to the age of 13. I know there's a couple other ones that are further behind for even younger children, but
Okay.
right now that's the one that's the closest to being something that we can actually like, hey, this summer if you got a 13 and up, it's gonna be time to go and get that vaccine.
Okay. All right. That goes to our question. I'm checking out. Okay. Wow. This is an interesting question. This has nothing to do with COVID-19. They
Okay.
just want to know how you, I guess, how you end up becoming a pharmacist. I guess that you go to school or whatnot. So a question
Oh,
about,
okay. Yeah. So
oh,
pharmacy.
hey, I guess the thing that you look at you look kind of young and whatnot, and knowledgeable and stuff. I guess it's what. But anyway, go ahead.
All right. Oh, yeah. So pharmacy, it's a 4-year doctorate program. So generally speaking, you do 4 years of undergrad. So you go to college and you can major in biology or chemistry, one of those in pre-professional, and then you'll just apply to pharmacy school. And there's lots and lots of pharmacy schools out there. I want to say Mississippi has 3 or 4. I know Tennessee has like 8 of them. Ole Miss, I want to say they do a 6-year program where you can get your bachelor's and your doctorate of pharmacy in 6 years as opposed to 8. So there's lots of ways to go about it. It's a very interesting profession. You get to help people and you're very accessible. And that's probably my favorite part about it is that, anybody can show up at the pharmacy and ask me a question. You don't have to schedule an appointment. You don't have to do this. You don't have to do that. Now, there's pros and cons to that when you're actually working
Yeah.
and you got stuff to do. But for me and my personality, just in general, being available to be able to answer questions and help people out is a big plus.
All right. And there's another question. So will people be able to get a set up program of vaccination at any and all Walgreens or just certain Walgreens?
So for the most part, yes. They're spreading the vaccine around as we are getting it. Right now, the supply had been sort of the issue. I even got an email yesterday saying, like, hey, there's limited doses available in Tennessee. Click this link to schedule your dose, schedule your vaccine. When you schedule it, they actually go ahead and schedule you for both appointments at the same time. So
Oh,
like
okay.
this one on this day, getting this one on that day. They're being very, very careful to not like overschedule or underschedule because we don't want to waste any doses.
Gotcha.
Right. So pretty much if you go to the Walgreens.com website, that's like the first thing on there. You click on there and it's like, how to schedule your COVID vaccine. And then you click on the button next to it where it says more information about the COVID vaccine. That's where you'll find me more information about the vaccine.
Okay. All right, the question. The gentleman, he got his shot, his wife won't do it. He's been trying. He don't want to get kicked out the house. You got anything, suggestions? I mean, hey, I know any suggestions that you can help for him to help him move his wife?
So I guess the real question will be another question is just, sort of why does the wife not want to get the vaccine? Does she have some concerns about side effects or adverse events? Is there a particular reason why she doesn't want to get the vaccine? And, and it is. And like when I've done these informationals with like churches and things like that, yes, I personally would love for everybody to go out there and get that vaccine. That's me. But my goal with these is usually just to give people information because a lot of reasons why people are hesitant to get the vaccine or say they're not going to get the vaccine is based upon fear. And a lot of times that fear comes from a lack of information. I know we're streaming on Facebook now, right?
Right.
So on Facebook, you're going to find that one person who got the vaccine who, ended up having some kind of a seizure or something like that. Like those are the ones that make the Facebook and the Instagram and, that's what we see. So like if I'm scrolling through Facebook, every bad thing about the vaccine will pop up. You're not going to see the other literally 200 million people who got the vaccine. It was like, yeah, my arm was hurting a little bit, but I feel good now and I'm vaccinated. We don't focus on that in social media. We focus on the one or two, negative cases or things that have gone wrong. And that's the beauty of social media is we can be very transparent. Like, hey, my mom got the vaccine and something bad happened. I just want to share that with y'all. But that's the one that gets spread. That's the one that goes viral, literally goes viral. That's the one that gets all the likes. The, hey, Dr. Nate got vaccinated, now he's protected. Nobody wants to hear that. That's not exciting. That's not, newsworthy, because lots and lots of people are doing that. So I would find out what the concern is. And then, the CDC.gov website, it has information on every single little thing about the vaccine and the virus. So, find out what that concern is, try to just get that information. Some people are just not going to want to take the vaccine, and that's understandable, but make sure we're still doing everything else. We're wearing our mask and we're doing all of these things. And then, it's your wife, right? So, we're going to show her some love and how much you love her and you care about her and you want to protect her, because that's your God-given duty as her husband, to protect her, right?
All right, okay. Well, I guess he just kicked out of the house, he can come move in with me anyway. All right. Well, look, we may have some more questions, but we're almost up to the top of the hour. Look, Dr. Nate, it's been great. Is there anything else you want to share before we get ready to sign off? And we do give a warning to you that we do hang on for a few minutes after we log off social media for those who are on Zoom system. Is there anything else that you want to share before we end our social media part?
Just my email address. It's nathaniel.boutte@walgreens.com. That's nathaniel.boutte@walgreens.com. I welcome all questions. Feel free to shoot me an email. Give me a call at the job. My information, you email me. I have all my information on the card. You had questions about pharmacy, applying to pharmacy school. If you have questions about the vaccine, the gentleman, if you want me to talk to your wife, I would love to talk to her, answer any questions that she has. Like I said, I had to convince, my in-laws to get the vaccine.
Okay.
And they had concerns and questions. I've had to convince some of my employees, they had concerns and questions. Like, let me just answer your concerns and questions.
Gotcha.
You make your choice. There's not a right or wrong thing in this. It's, it's a personal decision, and I get that. We try to make sure that there's not like fear from social media or politics or anything like that going on as the reason why people are not getting their vaccine. But beyond that, no, just if you guys have any questions, go to walgreens.com website. All the information that you should need to be right there.
All right, again, thank you, Dr. Nate. Dr. Nathaniel Boutte has been with us today on this month's Third Wednesday Resource Chat. Thank you so much for your insights today.
All right, it's my pleasure.
All right, everybody, look, for those that are on social media, we're getting ready to sign off. We're going to give a quick update on the general health insurance updates. We know that on April 1st, through the American Rescue Plan, the Biden administration increased the subsidies for the Affordable Care Act, Obamacare. So if for those that don't have insurance, that's a good opportunity to get in contact or go to healthcare.gov or call us at 662-298-3584. Look, some of you parents whose kids are covered by Medicaid and the Children's Health Insurance Program, CHIP, you're going around without health insurance. Well, with these new subsidies, it may be an opportunity for you to qualify for health insurance. And of course, if all else fails on those counts, Mississippi has one of the best networks of federally qualified community health centers. And if you need assistance in connecting with one of them, again, give us a call at 662-298-3584. Look, we hope that you will join us on our next Wednesday Parents Resource Chat, which will be Wednesday, May 19th at 11 a.m. We're working on the topic and our guests at this time, and we'll share additional information soon. So on behalf of all of the team members of Healthy Kids Mississippi, all across the state of Mississippi, our board chair, Jennifer Garrett, our our project director, Lonnie Miner, and yours truly, Michael Miner, the executive director. We thank you so much for joining us today. This has been a production of Oak Hill Regional Community Development Corporation. Have a wonderful rest of your day.